Hello and welcome to Unit 34, all about promoting positive behaviour. Some people present with challenging behaviour, but we need to be careful around our approaches. We need to be careful about the words that we're using as well, because some of those can trigger strong emotions. Equally, sometimes people may not be challenging within their behaviour. It may be signs of frustration. We're simply not recognising proper signs. People can get frustrated with themselves in health for many reasons. Some to do with memory loss, some to do with confusion, or maybe because of the way in which we are presenting ourselves in an authoritarian role. Caring and nursing isn't about positions of power or trying to use positions of power. We try to equalise as much as we can, meaning we need to be careful around the way in which we talk to people. There are certain things in which we can do to promote positive behaviours, and there are certain legislations and policies there that help us do that. Within your induction training, you learned some breakaway techniques. And it's important to remember we should only be using breakaway techniques as a last resort. We want to foster a culture where we all feel safe. But that's a two-way road. The customers need to feel safe from us, and we need to feel safe around customers. Let's move forward. Learning Outcome 1 wants us to understand how legislation frameworks and code of practice and policies relate to positive behaviour. So let's think about some of the legislation we have. We know that we have safeguarding legislation, protecting people from harm and abuse. We know we have legislation around moving and handling. We have legislation around communication and confidentiality, around medication and the correct use of medication, and that we're not using it to control or restrain people. We have the Mental Capacity Act. We know that people have choices and they may make unwise choices. So we're aware that around legislation, there's lots of things there. Ultimately, we also have the Health and Safety at Work Act and the Care Act 2014. So alongside our codes of practices, one of our main codes of practice is to do no harm. Therefore, any techniques that we use need to be non-abusive. We need to make sure that we don't control people through pain or through fear, but through mutual respect. Sometimes that's not always possible, and people do escalate and things do need to take or be handled in a different way. But for the majority of us, we are able to manage situations by using our communication skills and our ability to empathise and sympathise. I always say to people, it's important to recognise and observe people. So when we're caring for people, we're watching them. If you see somebody getting upset or angry, don't be afraid to say, I can see, and then what you can see. So if you can see somebody's getting agitated, recognise that. Say, I can see you're agitated right now. What can I do to help you? But it's about that active listening skill. You need to hear what they've got to say. You may not like what they're going to say, but you need to hear it. So let's look at some of the proactive and reactive strategies. But before we can do that, we need to think about what they are. So proactive means we're going to put procedures in place or policies and processes in place that stop challenging behaviour in the first place or stop somebody escalating. So what might they be? Well, they could be things such as keeping people busy, recognising that people are distressed. Maybe there's signs or through psychosis or through ill health where they need medication. Maybe it's the case that when we see people getting agitated, we find a way to de-escalate them, sensory rooms, or going for a gym workout or a run. Reactive is about dealing with the situation. So, do we put you on a warning system, like an ABC chart? Do we find other ways of dealing with you? 2.2 wants us to identify the proactive and reactive strategies within our own area of work. Our strategies within care is that we don't end up in conflict. We try not to argue with people, and we try to de-escalate as much as we can. So what does that mean? Well, if somebody's arguing with us or shouting at us, we could say to them, I can see you're angry and I'm going to come back in a short time. Or I can see you're angry. Do you want to sit down and talk about this? We can keep people busy, meaningful activities, things that they're able to do within their own limits. It might be recognizing certain times of the year or anniversaries or dates, so having that insight into somebody's life. Reactive strategy for us in health and social care is the fact that you've been taught de-escalation techniques. You know how to get away from a breakaway and to move yourself to safety. It might be the fact that we use distraction, mindfulness, or even medication. 2.3 wants you to explain the importance of identifying patterns of behaviour and triggers. This is more so important, especially when working with people with learning disabilities or mental health. Sometimes people aren't able to tell you that they're angry. They lack the ability to explain their emotions. So therefore, we need to do our detective work. Maybe there's been a bit of conflict in the past in somebody's life. It could be the fact that a certain person looks like somebody that's harmed them in the past, and therefore they present in a challenging way. It may be due to illness during a certain time of the day, maybe medication is wearing off. Or alternatively, it could just be an anniversary or even a day of the week. I have a particular customer that I work with who doesn't like Fridays, and Fridays are always a challenging day. We also have the common phrase in mental health about the moon. So again, people do move with the cycle of the moon. So it's important to recognise when things can be difficult. Other days and anniversaries can be difficult for people to handle as well, such as Valentine's Day, when you realise that there isn't anybody there and you feel unloved, or maybe your birthday and nobody's going to celebrate it, or even maybe Christmas and celebrations where there's a significant period of loss and you feel lonely. So what's the importance of maintaining personal-centred approaches? By understanding people's needs, you're able to plan for them. So, for example, if you knew there was an anniversary of somebody coming around, maybe a loss of a loved one, then we could be sensitive around that particular time. We're able to put some strategies in place, distraction ones, keeping people busy. It's important to understand that some people will work well to authority and some people will rebel against authority. Some people will work well with medication and some people will work well with other therapeutic activities. I always had the phrase that a cup of tea can cure everything. That's not the case in health and social care. I made a mistake once by giving somebody a cup of tea because I thought it was help, and then it was thrown at me. So it's important to realise not everybody wants to be treated the way that you want to be treated. Remember, if we reinforce positive behaviour and we recognise when people are doing well, it's much easier to identify when people aren't. So reinforcing positive behaviour is a key step in health and social care. You can do that by reward systems, reward charts, or just recognising good behaviour. By positively reinforcing good behaviour, it makes it more acceptable or it helps people realise what is not acceptable. 2.6 wants you to evaluate the impact on individuals' well-being, being reactive rather than proactive strategies. Dealing with people and well-being is all about ensuring that we support people at a time of need, making sure that we recognise. We're giving people an opportunity to make mistakes and also show their emotions. Let's not forget that anger is an emotion. It just needs to be managed properly. Imagine if I took away your anger and you had an inability to show that. You'd be frustrated because you're not able to get it out of your system. Therefore, it's important for people's well-being that we recognise that people can get upset or angry over certain situations. It's about validating that and ensuring that people are treated fairly. Um, and we recognise that people do get upset and angry. It's about us exploring with them other ways of managing those feelings. Number 3, understand the use of reactive interventions. Define what is meant by restrictive interventions. So restrictive interventions are all about me controlling you, taking away your right, maybe secluding you, giving you medications. It's illegal to restrain somebody. For us to do that, we have to have certain policies and procedures in place. We need to ensure that if we do restrain people, that it's appropriate to do so. As without so, it would be seen as a physical assault or a physical abuse. If it is necessary to restrain people, you may have a Dole's Act, a deprivation of liberties order. Generally, they're in place to protect yourselves and others, and they'll give you clear guidance on how to manage people. Remember, if we send people to their room, we are isolating them. And imagine how you would feel if you was told to go to your room. It makes you feel devalued. It makes you feel like you've done something wrong or you're naughty. What's more important is giving somebody an opportunity to talk about their feelings. Ask them how they got to that level of anger, what it is that didn't happen. Granted, that doesn't work all the time, especially with people who find it difficult to manage their feelings. Normally, people with severe anger or anger issues will have different care plans around those. They may have a PRN medication, so a medication to be given if they get angry, such as risperidone or haloperidol. It's important that we track those and we recognise duty of care. 3.4 is about describing safeguards that need to be in place if restrictive physical interventions are used. It's important to realise that if you restrain somebody, you must be trained in physical interventions, PI. You may have done a course such as PMVA, which is about holding people in safe positions. It is possible to kill somebody by accident by holding them in an incorrect position. You could cause further injury to yourself or further injury to the customer or the service. Misuse of medication will have massive consequences on their body and their organs and the way that they function. So it's really important to ensure that we use any physical intervention correctly and as trained for that person. Therefore, you must not carry out any physical interventions unless you are trained to do so. It's important to recognise that if a physical intervention or restraint is taking place, that we learn from them. Generally, after an intervention, you'll go into a debriefing room or you'll have a debriefing meeting. And we do lessons learned. What happened? What were the triggers? What were the missed opportunities? How did we get to that situation? What interventions worked? How were we able to reduce the aggression? Was chemicals involved, or was there some level of physical results, physical interventions there? Equally, what's the long-term impact? Do we now have to monitor physical health? Medications being given, do we have to carry out vital signs, making sure that their blood pressure is fine and their pulse level is fine? If we've done a restraint, have we checked them for further injuries? Being able to promote positive behaviour is good for everyone. It enables us to create a safe environment. So a range of factors associated with challenging behaviour, or explain a range of factors associated with challenging behaviour, could be many things. It could be around the lack of communication. They could just be in pain or discomfort. There may be things around medication. Alternatively, it could be an environmental impact. So therefore, we need to make sure that the environment is right. Imagine being stuck with somebody all day long that you didn't like. Maybe you can't communicate with them clearly and effectively. Therefore, it's important to make sure that you review those factors. If you have any concerns, please make sure that you talk to the registered nurse, who will carry out an assessment. Remember, people act differently because of their environment. Maybe they've had a stimulant or a stimuli that's caused them to be like this. It's important to record anything that you believe could be a factor associated with that challenging behaviour. Make sure that you complete the relevant paperwork, as this will help promote better strategies moving forward. We can avoid certain stimuli and stimulants that affect people's behaviour, then we're more of an opportunity to create the right care plans that are personal centred. Again, if people are managing their behaviour well, and you notice that people are learning from negative impacts, it's important to praise them for that. Imagine how you would feel if all you ever got done was told off for doing something wrong, but never congratulated for doing something right. It causes self-esteem issues and causes mental health issues. Therefore, it's important that we model good behaviour and promote behaviour. So how can you do that in your role? Well, if you see a situation that they handle it well, congratulate them on handling it well. If you see that they've dealt with a situation where it's been emotionally challenging and they've not reacted, again, talk to them about that. Allow them opportunities to discuss their feelings and emotions. This will help you promoting positive behaviour. It's important that you take time to discuss things with people. Remember, that goes back to your Unit 1 qualifications in the Skills of Care certificate and within Unit 1 of this qualification. It's all around communication. If you make somebody feel rushed, they're not going to sit down and talk to you. They're not going to talk to you if they feel that you're in an authoritarian position with them. So it's important that you sit down and discuss things on a one-to-one with privacy and dignity. So let's move on to section 5, and that's being able to respond appropriately to challenging behaviour. So you need to be able to identify different types of challenging behaviour. We know that there's verbal aggression, physical aggression, or maybe you could see somebody sitting there scheming and you're just concerned. So verbal aggression can be just as harmful as physically assaulting somebody. It's important to identify to verbal aggression and explain about the barriers and what's appropriate behaviour. Again, ensuring that your environment is safe, calling for help if necessary, and discussing where the anger or the frustration is coming from. If physical aggression is taking place, it's important to look after the vulnerable people in the room, people that are unable to move. Therefore, sometimes it's easier to move everyone out of the other person's way to be able to deal with challenging behaviour. Again, it's distressing for people to observe challenging behaviour because they'll feel frightened and intimidated of that person. So it's important that people see that you're not walking away from it. When responding to an incident, you need to make sure that you're going to follow the agreed plans of working. In other words, call for help. It may be the case that you can de-escalate somebody just by talking to them, trying to understand or empathize with them, recognizing the fact that they're in pain and distress. It might be the case that you want to ask them to come to a more private area. Maybe they need to go for a walk around the garden. Or alternatively, maybe you can find distraction techniques, music or a movie, and allow a person opportunity to calm down. You may have other techniques such as counting or mindfulness. Or alternatively, if the push comes to shove and you need to use de-escalation techniques, that you're in a position to do so, and that you're trained and you're confident in using those techniques. So explain the steps to maintain people's dignity and respect. It's very difficult when dealing with a challenging behaviour. However, imagine how you would want to be treated. If people started to speak to you in a negative way, you'd feel demoralised. And again, that could trigger your aggression. If you're pointing or to people, again, you could feel threatened. So giving people the opportunity and the space to show their emotions and to provide an area in which they can do that shows that you're treated with respect. It's important that you complete physical intervention paperwork, such as ABC charts or incident reports. This allows your manager or your clinical team an opportunity to review what the incident was and what the triggers were, and how things de-escalated and calmed down. So number 6 is about being able to support individuals and others to follow incidences of challenging behaviour. You need to be able to use methods to support an individual to return to a calm state following an incident. So identifying the trigger and knowing what the triggers are is a key important factor, because again, you don't want to use words or say things that can trigger them. You need to be careful about what you're offering them, whether or not it can be turned to use as a weapon against you. So offering them a hot drink, they could use the cup or the hot fluid. Ensuring that they're in a calm state following an incident may mean that they want to sleep something off. They may just want to relax, or maybe they don't want to talk at all. Breathing techniques is always good, because we know in a physiological way our heart rate increases, and as we breathe more, we're getting more oxygen in and less carbon dioxide. So slowing the breathing down to help re-regulate it will help reduce the breathing. We also know that when we get angry, we produce a lot of chemicals such as dopamine. So it's important we have an opportunity to work through some of that for our chemicals and on our brain to calm back down. We've all been angry, and we all know what it feels like to be angry. So it's important that we use those skills to help others, giving them the time to calm down. Remember, using language like calm down will only make somebody more angry. You could use your observational skills to say, I can see you're angry, or I can still see you're upset about this. Remember, when people do calm down from being angry, they can become emotional and tearful. They feel embarrassed about their behaviour or what they've done. Again, providing people with the space is important, and trying to get to the root cause of the problem is key. So reflecting on the incident afterwards is simply ask them, how are they feeling at the time, prior and afterwards the incident? How do they feel about the behaviour? What do they think about the consequence of their behaviour? And how would they and how they are feeling after the incident? It's important to give people an opportunity to work through those processes, try and find out some of the things we can do to help them. And it might be clear that actually somebody who's displayed that challenging behaviour has displayed it because actually they were a victim of something. It's important that we don't judge people. Six point 3 wants you to describe the complex feelings that may be experienced by others involving or witnessing an incident of challenging behaviour. Some people may have experienced domestic abuse or domestic violence, or have seen lots of aggression in the past. This can cause feelings of fear, worry, and anxiety. Therefore, it's important for people to feel safe at all times. The moment we don't feel safe, we start to live on the edge, meaning we may not be eating, we may not sleep properly, we may not want to take our medication, and we start to live in fear. We clearly don't want people that we work with to be in that situation. Therefore, it's important to give people space and time to talk about their feelings. So if they've observed something, allowing them an opportunity to talk to them. Don't be afraid to ask somebody about how they feel after what they've seen. It's important that you debrief others involved with the incidents as well, as again, other people may have dealt with this behaviour before. They may have different ways or different techniques, or something that you have done may have worked that other people haven't tried before. So it's important to have a debrief and to really get to the root cause. By ignoring this, you will simply allow an opportunity for the aggression to happen again. Therefore, it's imperative that after every challenging behaviour, you have a meeting to talk about what the triggers were, what was done, and clearing up the aftermath. 6.5 describes the steps that you should take to check for injuries following an incident of challenging behaviour. Again, you will have done your first aid training. You'd have done your primary survey and secondary survey. It's important to show people that you care. It's important to ask somebody whether or not they've got any injuries. Remember, they may be embarrassed already about their anger. There could have been an opportunity where they self-harmed and have further injuries hidden. So it's important to try and give them an opportunity and safe space to discuss their injuries. Number 7 is about reviewing and revising approaches of positive behaviour. 7.1 wants you to work with others to analyse the behaviour and consequences. Therefore, if you have an opportunity to do your debriefings and you have team meetings and you have an opportunity to review the care plan, that's a great time. But sometimes when we loan work, we don't have those opportunities. Therefore, we need to review it through paperwork. So if we have good incident reporting, good ABC charts and other records, we're able to review those on a regular basis. We're able to work with others to review approaches. So again, more people involved, the more likely it is we're going to come up with better solutions. Remember, these people have had family as well. Sometimes it's useful to talk to family members. You could ask them what approaches did they use in the past that they may or may not have found helpful. And finally, following an incident, it's important you're able to reflect on your role and how you felt about it. You can learn from many lessons. And remember what we said early on in your training in Unit 2 about reflective practice. You too could use Gibbs' assessment cycle to review your thoughts and feelings. So let's summarise. Learning outcome 1 was about understanding frameworks and laws. So we have some here: the Equality Act, human rights, safeguarding the mental capacity, DULS, and health and safety at work. Learning outcome 2 was about understanding context of proactive and reactive strategies. The proactive strategies, e.g. prevention, planning in responses to known behaviours. Reactive is about the interventions that you're going to use as a result of the behaviour. You can use stages of behaviour. So again, depending on how well we know people, we can go through a traffic light approach. People may start off just by pacing, tapping, shouting. Then it may go to hitting, screaming. Then we may end up lashing out and assaulting others into red. And then finally, we may end up on hurtful or harmful to others. It's important we use person-centered approaches because what works for one isn't going to work for others. Patterns of behaviour are important. We need to know about what their triggers are, how to maintain people's dignity, and looking at other things that will help us understand them. Positive behaviours need to be addressed because the more we address positive behaviours, the more effective our strategies can be. The happier people are, and the less likely it is you're going to see negative. We then have people's well-being, and it's important that we maintain the well-being, which is their emotional and psychological, physical health. Learning outcome 3 was understanding the use of the restrictions. So we've got physical restraints, mechanical restraints, chemical restraints, and seclusions. So physical restraints is us holding somebody down. Mechanical restraints might be the fact that we put you in a bed and put up your cot side, therefore you can't get out. Chemical restraints will be things such as medication, PRNs. And seclusions is where we isolate you in a room. You should understand planned interventions, and any kind of restraint should be the last result. Because any intervention that you use that involves a restraint will break down trust quickly with that person. It's important that we safeguard and we monitor people throughout. Staff are trained and we monitor health and physical and mental health throughout. We should be able to promote positive behaviour, both physical, cognitive, emotional and environmental. Positive strategies could be support plans, monitoring triggers, monitoring the personal-centred care plan, training, stages of behaviour, teams approaches, and modelling best practices. Learning outcome 5 is about being able to respond appropriately to incidences. So making sure the area is safe, calling for help, removing objects out of the way, and providing a safe space. It's important that we maintain dignity and respect throughout. Learning Outcome 6 wants you to be able to support individuals and others following an incident of challenging behaviour. Therefore, it's important that we work in an open, honest and transparent way. We look at reflecting on the incident, and we help with supporting others. We need to look at behaviours, so in the way that we work, and we need to review our approaches. You'll see in the unit guide that there are 3 recommended reading books. There are some reports which to have a look at. There is a new report coming out going beyond ABC charts, and there are new changes in 2020, April 2020, so now regarding physical interventions. You've got some websites there to have a look at. Again, within this assignment, you'll have the workbook to complete. You will have completed your breakaway training. If you're working with more challenging and aggressive people, you may do other trainings such as MABO or PVMA, depending on your environment. And alternatively, you will have completed our challenging behaviour or managing aggression DVD online and the multiple choice test. We'll have a range of evidence to support. I wish you all the best of luck, and I will see you in the next unit. Take care for now.